Diverging views are emerging at the Texas Capitol this summer over one single issue. The governor is calling on state lawmakers to enact more regulation of the booming THC industry, while some within his own party disagree with that and are once again pursuing an all-out ban. And as we await what legislation makes it out of that current special session that we are in, we wanted to better understand the product at the center of this debate. So joining us to do that is Dr. Greg Tung. He's the Associate Professor in the Colorado School of Public Health. Dr. Tung, thank you so much for joining us and being here. I know Will reached out to you because you're part of your school's cannabis research and policy project. Tell us a little bit about the work that you're doing there.
Yeah, thanks for having me. So the work we do at the Colorado School of Public Health as part of the Cannabis Education Research and Policy Project is really staying on top of the literature around what are the effects of cannabis. It's a project that was supported by the state legislature here in Colorado, so we also make recommendations to the state on what should happen. And the state has also charged us with running a public education and communication campaign around THC.
Well, then I think that you may be the best person to ask about this. So given that your work focuses on that and some of the policy debates that are playing out here in our state, help us understand what THC is exactly.
Yeah, sure. So THC is kind of the primary active component in cannabis or marijuana. So when we think about cannabis use and the high that many people associate with it, THC is the chemical component that actually generates that intoxication or high. And you know, THC in cannabis is also thought of and used of in other contexts, including medicinally. And so it also has potential and some evidence around beneficial and therapeutic uses as well. I'll just note that THC is one of the active components, but cannabis is a very complicated product, and there are other active components as well, including CBD. So.
Let's talk a little bit more about that, because you mentioned it. There is obviously, as we've been talking about, there's a divide here in Texas when it comes to how to view THC. Some see it as beneficial treatment, something that could help them medically. Others don't see it like that. They see it more of a threat. Where's the balance here? How do you do that?
Yeah, so that is one of the really tricky things in terms of thinking about regulating or creating laws around cannabis or THC, because it doesn't fit into either one of those categories really neatly. And I would say it's both. I mean, there's clear scientific evidence supporting therapeutic and beneficial uses for THC, and there is clear evidence pointing to negative effects and harms. So that is really the challenge. Are there medical benefits? Are there legitimate medical uses? My interpretation of the literature is yes. Are there very significant public health harms associated with cannabis use? I think the answer to that is also yes, and so that creates really significant challenges in terms of regulating it.
Dr. Tung, are you all working on any particular research to explore those two kind of diverging paths?
Yeah, I mean, the focus of our research, without getting too much into the details, is the kind of the research of research itself. We look at the full spectrum of scientific literature that's happening. We try to stay on top of it. We synthesize it and communicate it back to the kind of academic literature world and our state legislature. And so one of the things that we're communicating back is key in our talking points is that there are these legitimate medical uses, right? But there are these harms as well. And so what does that look like in terms of the needs and what should be happening from a regulation standpoint? I would say, in general, our research points to the legitimacy of creating a medical cannabis program so that those individuals that have conditions that can benefit from the use of it get access to it. But then there are certain populations where we say, you know, the harms are really just not worth the potential benefits or balances, and that's primarily in a recreational context. And I'll point out two populations that our project really highlights as being especially concerning for cannabis use, and that's youth, young adults, so anybody under 25, and pregnant women or pregnant individuals.
That's the harms you were talking about that could contribute to that. Does it have something to do with the percentage of THC in a product? Do you study any of that at all?
We do. That's actually a major focus of what we're looking at. And the tiny bit of context I'll give you here is that cannabis has really changed over the years and over the decades. You know, when I went to college in the 90s, the cannabis that was available was, you know, in the single digits in terms of THC percent concentration. And now in Colorado, the average THC concentration in flower is 20%. You can find products that are flower that's much higher. And you have entire new product classifications, edibles and concentrated products that are going to be 60, 70, 80, in excess of 90% THC. And so unsurprisingly, when you increase the concentration, you increase the effects. When those effects are beneficial, you know, maybe you increase it to the point where it's no longer beneficial, but certainly when you're looking at effects that are harmful and you increase the concentration, you're going to increase those harmful effects as well.
And one more question for you, Dr. Tung, before we let you go. And we again thank you for being with us. But some of the state senators here in Texas particularly have been pushing the idea that THC cannot be regulated. Based on what you've seen in your own research out there, is that true?
I would love to have a conversation with those individuals, but right here I'll say I respectfully disagree. I think it can be regulated. I will say regulating the concentration is very challenging, and there's this entire dynamic of how do you enforce it? What are the, you know, how might you be incentivizing an illegal market if you place regulations that are too stringent? So I think it's complicated and there's nuance, it's difficult to do, but my bottom line is I think you can regulate it, and there are states that do currently regulate it.
Well, this has certainly been a very helpful conversation for our viewers out there, because we are only beginning some of these difficult discussions in our own states. So, Dr. Tung, thank you again for being here with us and for giving us your time.
Thank you for having me.
All right.